All right, welcome everybody. Dr. Mike here, and today I want to talk to you about when people crack their own back. And so I've had patients ask me questions about, is it true if you crack your knuckles, do you get arthritis, do your knuckles get fat? A lot of us have been told that from our parents, grandparents. Don't crack your knuckles, you're going to get arthritis. Well, it's not true. As a matter of fact, the opposite is true. In between your joints is a fluid called synovial fluid. And inside the fluid, there's carbon dioxide and nitrogen bubbles, tiny little bubbles. So if I open the joint space, and I don't know if you heard that, but it popped, it creates a, and what that is a release of air, nitrogen and CO2 bubbles get released, and it creates a little, what's called cavitation. And what that does is it basically changes or recirculates the synovial fluid inside. It's kind of like changing the oil in your car. So that actually helps keep the joint healthy. As long as you don't stretch the ligaments beyond their elastic capacity and go in the opposite direction, right? Pulling or flexing forward is not a terrible thing to do. Now, when it comes to the spine, totally different story. Because now there's 24 bones. You have your nerve system in there called your spinal cord. You've got 24 discs. You've got all kinds of cartilage, ligaments, muscles, tendons, holding everything in place. And when you crack your own back or your own neck because you're stressed or you feel pain, what happens is you create what's called hypermobilities, meaning that part of the spine moves too much. And when that part moves too much, let's say in your neck, because you've got 7 bones, let's say when you crack it, you get movement in C5 and C6. Now you're hypermobilizing that segment. So then the rest do what? Well, they don't have to move that much anymore. So you create this, it's almost like a kinetic chain of events. It's like shifting the gear just a little bit, and now the gears don't work well together. It's like a domino effect. So as that area moves too much, the others don't move enough. And sometimes arthritis, disc degeneration, disc herniation, pinched nerves can be the end result. Not a great idea. Let a professional handle that. If you're feeling tension in the neck, shoulders, or back, get checked, because you might have a spinal imbalance, what we call a subluxation, that a chiropractor could fix very easily. So with that, I want to wish you all a great day and tell you, make sure you stay informed and get adjusted.